Okay.
Yeah, public service, even there's different times. I don't really believe right now. Suggesting if you are going to be engaged, there's a lot of meetings,
I don't know what
individual things like this coming up. Stacks up. They can follow you.
between the
Yeah.
really right from the yes, yeah, yeah. It's like once it's a Monday.
Kind of rotate small areas.
Testing. Okay.
It's just that. So your agenda should be up there, and then also the committee members.
Okay.
Yep.
Got it. Okay. Thank you. Hello, hello. All right, we are going to get started. Hey, Josh, is this supposed to be louder in here if I talk into this microphone? Oh, it's not. Okay. So this is just a prop? No, I'm just kidding. Well, welcome, everybody. We are so grateful and glad to see you. Thanks for making your way across the tracks on this early Thursday morning. My name is Molly Wyrens, and I am a pastoral associate at Christ Our Light Catholic Church just down the road here, and just so glad that we can be part of this. Lots of people are needed to help with this issue, and so we're glad that we have so many people represented, places represented. Certainly there are people that are not here that need to be, and that will come, but we just wanted to at least get started and come together. I first want to say just a special thank you to Crystal Cabinets. This is their space, so if we can give them a round of applause. Holly Martinson is part of Crystal Cabinets you saw when you came in the registration, so please greet her and thank her personally if you can. I also want to put out a shout out to Larry and to Emily back there, if you guys can wave. They're from mHealth Fairview, and they're helping host this along with our Rum River Housing and Homelessness Coalition. And especially Emily has been great at being a taskmaster, so in the most kind way. So that is awesome. So thank you for that. So as you see, we have the Rum River Housing and Homelessness Coalition that started about a year and a half ago, mainly with just a group of law enforcement, county folks, city folks, organization folks, and people from the community. Just sitting down to say, hey, what's going on? What are people seeing? And what do we think we can do about it? And should we do about it? Early on, we came up with a mission statement. Basically, we will work to educate, create awareness, and advocate for those experiencing homelessness or housing insecurity. We will collaborate with community partners to develop short and long-term solutions to the community needs as identified. So, you are part of that, and we're going to cover a lot today in a short amount of time. So we're going to kind of keep things going. Obviously, this is not a one and done meeting. So sorry if you were going to punch in and punch out, because we're going to invite people to continue this conversation, to possibly be in some working groups, to continue on different kind of parts of the solutions. So kind of be thinking about that as you go through this morning, where you might want to insert yourself to do some more work with that. Just a little piece, you've got the agenda, so this is what we're doing. These are also, if I can have the planning committee just stand. I've mentioned Emily and Larry. We have Jody from Sturgeon County, Cindy Lay from Open Doors for Youth, Holly Martinson's out in the back, Stacy Marcourt from the city of Princeton, couldn't be here today, but she is also involved. So if we can give them a round of applause, please. Thank you. And this is our graphics so far. We haven't gotten t-shirts, but I'm sure they will come soon. And also just housekeeping, restrooms, if you go out this door to the right and out this door to the left, you will find them. You will also find all kinds of ideas for your next home build. I think it was 50% off today, I'm just kidding. Don't put that on the video. And then the pub or the cafe in the back, just know that there's treats and things out for us, so continue to go back there as you wish to get some of those. So with that, I'm going to hand it off to Larry Hisek from mHealth Fairview. Thanks.
All right. Does everyone hear me okay? Okay, terrific. Well, good morning, everyone. My name's Larry Hiscock. My role within mHealth Fairview, I'm a Community Partnerships Manager. And so I have a geographic responsibility similar to Emily, who works in this service area. But I also work on our housing as health work. And as a health system, we are very much concerned about social determinants or social factors of health, because we know what contributes to people's health is more than just what happens in the clinical walls. Are we able to advance forward with or maybe I can take that, or do you want to do it? Okay, great. That's all right. We'll give it back to you. So just wanted to share a little bit about this for about 5 to 7 minutes. So when we're thinking about community health, what happens in the clinical walls is only 20% of the story. Most of it happens outside of our clinical walls when we are thinking about behaviors and choices, which are oftentimes shaped by opportunities that people have or their lived experience. But a huge chunk of this is what are considered social economic factors: education, job status, income, housing stability are really some of those key drivers behind how long are our neighbors living, the quality and health and well-being that they're experiencing. And so when we're looking at health, it's not very simple. And as a health system, our mission, we're driven to heal, to discover, and educate to support longer and healthier lives. And for us to be successful in our mission, not only do we need to be really doubling down on what's happening in our clinical walls, but really exploring ways on how we can partner with all of you to improve the health outcomes of our patients and our communities. And similarly, all of you are being impacted by housing in the work that you're doing. So thinking about how is it that you're able to really double down in your swim lane of work, but also kind of lift your head up out of the water to take a breath and see how you might collaborate with one another and each other to improve the lives of families and children that are living in our communities. Just to kind of highlight sort of the significant impact that housing has on health and well-being. So housing instability contributes up to a 17-year difference in life expectancy. So that's significant. When we're thinking about just broadly about for health systems, 1/3 of our emergency department visits are from people who are experiencing homelessness. And those folks who are cycling back into that emergency department, over half are, of those homeless individuals are likely to be readmitted. So our ability to sort of think through and how to address people's housing insecurity, homelessness, eviction, those home repairs really matter. And what we also know when thinking about our children, for our, children in our community who are moving more than 3 times in a year, that is associated with negative health outcomes for those young people. And that has not only an impact on that child for their lifetime, but also their ability for education attainment and impacts just our community in general. So we're really in this together. So when we did a survey of our care team members, these are the top housing-related things that they're hearing. Homelessness, people are staying with friends, family, living in cars and tents. People are struggling with foreclosures and also eviction notices, home repair and tenant-landlord disputes. All of these things that we're hearing from our patients are really things that are outside of our clinical walls that we really are looking to. How is it that we partner, collaborate with all of you? How are we strengthening our community's social fabric so that our patients have those things? So we've talked a little bit about the health system. I wanted just to provide some larger information, and this is from the Wilder homelessness study that was just done this last year. And just to draw out some specific information regarding Greater Minnesota, not just about the Twin Cities. So based upon those surveys of people who are experiencing homelessness in Greater Minnesota, 77% reported at least one adverse childhood experience. And over half of homeless individuals experienced at least 3 or more adverse childhood experiences. So oftentimes people who are experiencing homelessness have had struggles on multiple occasions throughout their life, the course of their life. And for people who are experiencing homelessness in our communities, 60% reported experiencing violence while homeless. So this is a public safety issue. This is a health and well-being issue on so many levels. And I know I'm sure as first responders who are working with individuals, you're in a spot where you're navigating things and there's only so much you can fix or address in that moment. So again, this is an opportunity with all of us in this space, thinking about how is it that we support one another to really, again, support our neighbors. Yeah, we'll see if I can quick pop that down. You got that? So wanted to also, from that study, highlight again some of what was heard from folks in greater Minnesota and communities. When they were asked what was the biggest challenges for them to secure stable housing, 55% reported that there was just not enough affordable housing for them to find to support themselves or their family. They also indicated, just over 40% that their credit history was a barrier to them securing stable housing. And then also no local rental history or references to help them secure that. So those were some of the big barriers that showed up in this study for specifically individuals who are experiencing homelessness. I know some of our upcoming speakers are going to get more specific about the specific cities and counties right around in here, but I just wanted to provide that as a groundwork and also really highlight that we're really in this all together. The status, people's experiences around housing not only impacts the health systems, it impacts our business owners, our workforce, county services, public safety, all of these factors. It impacts all of us in so many ways. So our ability to collectively come together, identify shared strategies so that we can improve outcomes for everyone really matters. So again, thank you all for being here this morning, and I'll pass it on to our next set of speakers.
So obviously when we look at these issues, data is important. So I will out myself just for a moment. So at church last week, I got an email saying, we got these credit cards that we all have, right? And they said, Molly, you have made a couple of personal purchases on the credit card. And I'm like, I know you guys, it's totally, like, I'm not doing it on purpose. It's like I'm in the middle of ordering something for church, and then I put something on for me, like a book. We're not talking like a car, okay? So it's like a book, and then it gets charged, right? So I'm like, okay, I know I've done 3, okay? So I go back to my office, and the business manager sends me the data, and there were 10. So I'm like, ooh, I'm busted. Okay, but the data helped. I'm like, oh my gosh, you guys, I didn't know this. I'm so sorry, and thank you, kind of, but anyway, so data does matter, because if we know what's going on and we have things to prove that, obviously that makes a difference. So we are calling upon Lori Irwin and Jessica Unkelhauser and Cindy to come up and share with us the data that they've seen in this area regarding this issue. So I invite them forward. Yes? Yeah. Yep. And we're also recording this, and the recording will also be available. Yeah. Thanks, man.
How do you like your new Range Rover?
I will tell you later. It was a present for my boss. Okay. Here's that, and then there's this.
I think we're all just gonna come up here and sit, and that I feel with other people. Yes. And then I won't be able to see the screen. That's okay. Okay. Maybe I can turn. No pressure, guys. No pressure. Let's flip. This is, we have a housing resource guy. I'm Lori Irwin, and I work at Sherburne County. I'm the housing resource specialist. I'm one of the 2, which is on the next slide, one of the 2, right there, full-time social workers for housing. There's me and another person, and she does the housing outreach, and I do the housing resource specialist is kind of my title. So she goes out and she finds people and she lets people know that they're, go closer. Okay. Oh, not me. Okay.
Stay out of the way.
She'll go out, like we have wellness buses that go out, that goes out to St. Cloud and Zimmerman and Big Lake, and we're there to meet with people who are in need of helps in going out to them. And so I do more of the case management. I work with people who are more like not as imminent risk. Hers are more like in a crisis. They're losing their housing right now. Mine are more, they're doubled up and they need they need housing. It's like they're not on a lease, but they have a little bit of time still, which it's still not. It's still housing instability. And okay, so I was hired on September 2021. And so we have some data from that time period. And then this is our goal. Our goal and mission is to reduce homelessness in Sherburne County, assist individuals with resources and supports to secure long-term housing options, collaborate and connect individuals to community resources to address underlying struggles, and encouraging healthy well-being and functioning. That sounds good. Yes, that's great. That's exactly what I meant. So like some of the things that I see people who have like a lot of high barriers to getting into housing, but we do a housing first approach. So there's no requirements to get into housing. They don't have to, I don't have to look at it. They don't have to finish any treatment or anything else. And in the time frame that from September 13th, 2021 to September 30th, 2024, there's been 577 families that I've worked with, which is, I've been busy, very busy. That's 192 individuals per year is how it breaks down. And something, I don't know, is that the next one? Maybe? Oh, that's just the housing status. And 59% of them were employed. And so I was actually driving here on my way, and I drove by one of the families that I've worked with, and they were working. And so I think it's the 59% is a high percentage of people that are employed and facing housing instability. And so showing the data, showing that there's a need is really important. If we don't have, the Wilder study or the PIC count, which is the point in time count, which we have every year at the fourth Wednesday in January. And we want to show the actual need of people who are experiencing homelessness in our area. I think it's harder because we don't see them. They're not ready to be counted and ready to go. They're more doubled up. They may not identify as experiencing homelessness. They may be living with friends, family, couch surfing, but they are there. We just can't see them as out in the open. But yeah, so this is the from my data. This is the percentage. Like a lot of ours is doubled up in couch surfing, so the long 162, and then like Ashton, our outreach worker, would work with more like imminent, or homeless, like out in their cars, which is still 128. Next one. So this is just breaking it down by city. Oop, we're on a huddle again. So I think the biggest part is in each city is the gray is the doubled up couch surfing, which is pretty large. It's in most of them. Zimmerman, Princeton, where we are. So that gray, again, is going to be that doubled up couch surfing, but the actual homeless is pretty large too. It's 22%. So getting people counted is really important because then we can get programs and affordable housing to show that for these people who need it. Let's see. I think that's it. Oh, I just want to talk a little bit more about this part. So like that's kind of what we're all talking about is the housing first, but also surrounding them with the services that they may need. So they're both going to talk as well, so I'm going to give them the microphone, but all these different things that we can surround them with to give them services so that they can be successful. Okay, here's.
All right, I think I'm going to stand because this is kind of an awkward angle here. I think first and foremost, before I talk about my youth-specific data, what we heard from Larry and Lori is I think all of that data helps dispel some of the myth or misunderstanding about that homelessness only exists in metro areas. Twin Cities, St. Cloud, those larger urban communities. And I think especially what Larry pointed out, that showed the majority, the higher percentages, fell in greater Minnesota. And that coincides with what Lori said as well. So I think that's one message that we're really trying to get across to folks in our rural communities, that we do have people experiencing homelessness in our community. It's not just in the big cities, and they're not just passing through. They are our community members and residents here in our very own communities. So I'm going to talk specifically about youth homelessness, because that's what I do at Open Doors for Youth. We work with youth ages 16 to 24. Oh, thank you. It's the worn out button I see. So just a quick, really brief background about Open Doors for Youth. We are a nonprofit. We're located in Elk River. We've been open since 2015. And again, we work with youth ages 16 to 24 who are experiencing homelessness or housing instability. We serve youth in Sherburne County, Wright County, a little bit into Mille Lacs County. And our main goal, really, we operate a drop-in center, and then beyond that, we make connections for youth to area service providers to help them work on more long-term needs. Again, staying along the lines of rural homelessness, we know that it exists in every community, regardless. And again, they're not just folks passing through, they are people, our neighbors, they're our neighbors. And kind of along with what Lori said, often that we consider them an invisible population. The majority of people in our community who are experiencing homelessness are couch hopping. So we don't see them out on the streets, we don't see them on the corners. In Elk River, you're not going to see them at a shelter because we don't have a shelter. We don't have housing programs for people of all ages experiencing homelessness in Elk River and many of their surrounding communities. So oftentimes people think, well, if I don't see them, they don't exist in my community, that it's not an issue that we need to band together to address. And that's simply not true. They are on people's couches, they're in their basements. And the last two bullet points, again, just to reiterate that there is a lack of shelters specifically for youth, and there's a lack of transitional housing, any housing programs really that are specifically suited for young people. Through Chapin Hall, which is based out of the University of Chicago, their research indicates that it's a similar rate of youth homelessness from rural communities at 9.2% to non-rural, so that includes urban communities. So again, to dispel the myth that it's only happening in large urban communities, very similar rates of homelessness for young people. Wilder study has been quoted a couple of times now. They're based in Minnesota, and so Wilder estimates that 13,000 youth on their own under the age of 24 experience homelessness over the course of a year. And we know that nearly half of all people experiencing homelessness in Minnesota are young people 24 and under. So specifically, the housing situations for youth that we serve at Open Doors for Youth, very similar to what Lori has shared. The majority of our youth are couch hopping at 56%. This is data from the last 2 years, 22 and 23. 28% of our youth are with parents, so then again, people think, well, that's not a young person experiencing homelessness. But what we need to look at is, what is that home situation like? Often there are multiple signs, multiple experiences of abuse going on. There's substance use disorder, there's mental health issues. It is incredibly unstable. And our young people are in and out of that family home multiple times. So that is not a stable living situation for young people. 9% of the youth that we served in those 2 years have their own housing, but they're incredibly rent burdened and constantly at risk of being evicted, often behind on rent, unable to pay the other bills, unable to pay for their basic needs. 4% were in their car or outside. And then lastly, 62% of the youth that we served fit the definition of long-term homeless, which is a HUD definition. And what that means is that an individual experienced 4 or more episodes of homelessness over the course of 4 years, or one continuous year of homelessness. So that is an incredibly high percentage for people who are 24 years old or younger. And that really kind of sets a course for them to experience chronic homelessness as they continue to age. This is some data specifically from our agency. We, from 2015 through year end 2023, we've worked with 447 individual youth, over 7,000 visits at our center or virtually, which means texting, Zoom calls, phone calls, things like that. We average 80 to 90 individual youth per year. So that means we only count them once per year, but they come back, multiple times to the center. And so average about 30 youth visits per month. And you can see the numbers from most of our youth are from Sherburne County, 5% from Mille Lacs County, and I believe we served 9% from Wright County. And we don't limit who we serve based on geographic area. We are the only agency that's specifically focused on serving youth in Sherburne County and Wright County, and we draw youth from many different communities because of the lack of services, which is something that we're going to continue to talk about here today. So some of our housing resources, we're a drop-in center. We don't have a specific housing program. We do provide support for host homes, which means we have a young person that is staying with someone that they know and they trust, and it feels like a safe space for them. We come along and provide conflict resolution. We have a monthly stipend that we provide to that household because we know they're incurring additional expenses by hosting that young person. And so we've had 12 youth in host homes since 2017. Youth House was a transitional housing program that was operated by Catholic Charities St. Cloud. And over the years from 2016 to 2023, we placed 12 youth in Youth House. Transitional housing means that they're there for roughly 12 to 18 months. But unfortunately, Youth House closed in April of 2024 and really was the only youth-specific transitional housing program available. So that is a significant, devastating loss to our COC and our communities. Catholic Charities also operates what they call SHI, which is supportive housing for youth, and we have placed 8 youth in the SHI program. What that is more like, it's scattered site housing. They get some assistance from Catholic Charities up front to pay for that first month's rent, damage deposit, that significant chunk of money that we all need when we rent a new space. But then those young people need to show that they can sustain paying that rent over the course of time, which is difficult. Most of the youth that we serve are not financially stable enough to be able to do that. So that's not always a great option for the youth that we work with. So we provide that drop-in center as a safe space for them to come and access basic needs, and then we connect them to housing resources and other service providers. And I'm going to hand it off to Jessica.
Thank you. So I like to move when I talk, and I was really excited to see that there was a whiteboard because I also am one that likes to draw, even though I can't do it very well, my kids tell me. But sometimes, depending on how we see things when we learn, pictures are nice. So I might get off screen and go to the whiteboard here in a little bit, but I'll first start with just some of the data. So my name is Jessica Unkelhauser, and I work for Lakes and Pines. I'm the Emergency Services Program Manager. I have been with Lakes and Pines for about 4 years. Prior to that, I've done county social work. I've worked at child advocacy centers. I've worked at youth drop-in centers, both in rural and Duluth, St. Louis County, so urban areas. And I just want to say that what everybody has already talked about is rural homelessness is much different than the urban homelessness, and hoping that maybe that we can underline some of those differences today. So Lakes and Pines' mission is that to build prosperous communities by serving local families and individuals in their pursuit of self-reliance. We serve 7 counties. We serve Aiken, Chisago, Kanabec, Mille Lacs, Carlton, Isani, and Pine. Oh, wrong way. So I know I was asked to bring some data, so that's what I did. I brought some data first just to kind of talk about the households that were requesting services. Looking at the Princeton area, looking at singles, adults with no children, single parents, and two-parent families. And this is Princeton specific. Malacca, Isle. And if you can't see the numbers and you would like me to tell you, I can, but I also know you'll be getting this information. Garrison. So this is Lakes and Pines numbers. So anybody that's coming in and requesting services, this is what the households are looking like in these specific areas. Yep, so it would be October 23 to October 24. Forreston, and I concentrated in the Mille Lacs County area. And obviously when you see the smaller numbers, it means there's smaller numbers of individuals needing resources, or I should say accessing resources. So talking about barriers to housing stability, this is a very short list. This is not a extensive list. But after we get through the data and I start talking a little bit more, hopefully we can talk a little bit more about what those barriers look like. Gotta keep the mic up. I apologize, I'm not used to using a mic. I told you I was gonna rock back and forth, now I'm just turning. So barriers to housing stability. When they come in and they do an intake, everybody that does an intake at Lakes and Pines, obviously there's demographic information that we get, but we also ask them what are their barriers or needs. And that will go through, do you have poor credit, rental history, do you have food support, those pieces, because if it's something that they don't have, then we can make that referral to one of our service providers within the agency to connect with them. And it's also trying to create a picture of when we connect them to, say, one of our family coaches to work with them, they're looking at the barriers and looking at, okay, credit history is a significant barrier, and we have financial literacy, so we might connect them with financial literacy, but that's, you know, not something we do right away, because as Lori talked about, we are a housing first model. So what that means is when they come in, it doesn't matter what their situation is at that point, and if they're ready for services, they're eligible for services. And we meet them where they're at, and we honor what their lived experience is, and it's different than ours. So the barriers that we have here up on the slide are no or poor credit, evictions, no rental history, criminal history, and no income. I would say that those are significant barriers that you see often. I know that I believe we're going to have somebody talking about the coordinated entry system, and this is kind of the ones when we look at the risk assessment here in Central. These are those barriers, those underlying barriers. So looking at Princeton, and these households, just because there's 32 right now that say no credit or poor credit, they may also have evictions or no rental history. They might also have criminal history or no income. A lot of times families don't just have one barrier. And then in Malacca, same thing again. A lot of no credit or poor credit. Rental history, criminal history, no income. And that doesn't mean insufficient income. It was just when they came to us, they had no income at all. Isle, Garrison, Onamia, Forreston, and Bach. So now I'll talk a little bit about the housing services provided. With that, you're going to see on our charts, this is not all the housing services that we provide, but this is the ones that are tied to, say, the dollars, right? And so we're able to track that a little bit easier within the one program system that we have. So looking at an emergency services program, what services provided through that could be our street outreach program. We have a street outreach advocates who, if there is a, say, community member that calls and says, hey, I have an individual here who is homeless and needs some resources. Our street outreach advocates go out there. Typically, they'll bring a street outreach bag that has food, flyers, soap, hygiene materials, and offer that to them. And that's kind of a way to start that relationship. And some might just take the bag and say thank you. Some might sit down and have a conversation and want more services, so we're able to help access more services. One of them, again, under the emergency services program is the hotel voucher program. I know they've talked about the shelters in our area. So the 7 counties, I will tell you, we have a shelter in Pine City, a place for you that serves individuals. We have the New Pathways Family Shelter, and that's kind of through the Cambridge area. We also have Family Pathways. It's a DV shelter in Wakan. And then there's also the Mille Lacs Band DV shelter. But there's not enough, domestic violence. Apologize. If I say any acronyms and you don't know what it means, please raise your hand, because I use them even though I don't like them. So with that being said, there's over 600,000 square miles in those 7 counties, and that's the number of shelters we have to offer. And we have got the individuals, we've got families, and we've got DV. Sometimes you might have somebody who has an emergency support animal. You can't bring the animal to the shelter. So under the emergency services program, we have a hotel voucher program that is supposed to supplement those shelter beds that aren't available through shelter. We're able to assist them in getting a hotel for, usually depends on the need, but the first day is up to 7 days. Somebody might call and say, hey, I have to go to work tomorrow and I haven't showered in like 5 days and I've been sleeping in my car. I'd really like a nice hot shower. Has anybody ever gone camping and when you get home, what is the first thing you do? Take a nice hot shower with your nice hygiene products. It's self-care. Move-in costs, other services we provide. So if somebody has found housing, we talked about poor credit or no credit. And I know that was some demographic or some data that you've heard from all of us. Landlords are asking at sometimes whether they are a high-risk renter 3 times the deposit. So they're asking for not only first month's rent and maybe last month's rent, but they're looking at a 3-time deposit. I was looking at, we had file review yesterday, $4,500 just to move into an apartment. $4,500. 2 bedrooms. We have assisted people in just getting a room. So it's a shared housing space, and they have a room, they share the kitchen, they share the living room, $900 for a bedroom. We also provide eviction and foreclosure prevention, and that is through our Family Homeless Prevention and Assistance Program. And if someone goes through a crisis, whether it be that they lost their job, or if they broke up with their significant other, and now that's half the income that was going towards living costs, and they didn't make it, and now they're being evicted. So we can assist them with that eviction prevention, and it's one of the only programs that can help with that foreclosure prevention, because not a lot of the housing service programs look at mortgage, but through FHPAP we can. We worked with one family who, I'll name them, what was my name? I had a name for this family. I'll say Bobby. Family of 5. The youngest had a very rare form of leukemia, infant leukemia, and for 2 years, only one parent could work, And that was, you know, asking a parent to work full time while your infant is down at the children's hospital with your partner because it's a very rare form and they've got a lot of medical treatments. And they had just bought a house 2 years before that. Very nice house. Both of them were working. Everything was going great. After 2 years, they were able to sustain that, but then they got behind. And they didn't know where to go. They tried to work with their mortgage company to see if they could get it put back at the end. Well, then when you look at income to asset and credit, because I think they used a lot of credit to pay for their bills, they weren't eligible. So we were able to assist them because after 2 years, what was it, in June, they stopped the treatments, and then I think it was September that they were finally able to enroll their child into Head Start because of the immune system being so off. And you can agree with me, right? That they didn't want to expose their child to any potential infections or sicknesses. So now the other parent was able to go back to work, and we were able to help them catch up. So, getting back to the barriers, or the services. So these are the services that we're looking at. So ESP would be street outreach services or hotels. Not all hotels work with us because, well, a hotel is typically something you think about when you're going on vacation and you're going to get it with your family and you're going to hang out at the pool and have a great time. Sometimes when individuals who haven't taken a shower in 2 weeks, been sleeping in their car, been sleeping out in a tent, and it's been raining and it's been cold and they just want to be in somewhere warm, visually, they're not the most attractive. And so not all hotels will work with us, but we do have hotels in the area. And with the ESP, we can also assist with transportation to and from the hotel, move-in costs, and then eviction prevention. I'm kind of silent through this because I don't feel like I have to say the data. The data just kind of shows itself. Forreston, Wakan. All right, so this is where I'm going to veer off, and hopefully I won't mess up the mic. I guess I just wanted to kind of create a picture because we are here to talk about homelessness, and there's different definitions. There's different definitions if you're in the state of Minnesota or if you're looking at the federal government. So homelessness in Minnesota it can be considered where you're couch hopping or where you're staying with someone, but you can't stay with them too long because otherwise then you're considered stably housed. And I think it's 90 days? Depending on, okay. Up to a year now? Okay, because I know some places are like 90 days they've been there. Or if they don't have to leave, then they're considered stably housed. Even though that doesn't mean that in a week, the person you're staying with, you're going to get in a big old fight with, or they're going to steal something from you, and then you have to leave. But at the time that you're reaching out for services, you've been there, and at this point, you haven't been asked to leave, so sorry, you may not be eligible. Federal definition are streets, shelter, places not meant for habitation. And because we're rural, and I know I've offered this up to other people, is if you want to see rural homelessness, I will take you for a ride on the back roads. And you're going to see sometimes the old rundown mobile homes. Perhaps you're going to see an RV. It's inhabitable. There's no running water. There's no electric. But maybe all they have is land. Because a lot of times when we talk about assets or when you lose a member of the family, land may be the asset that someone inherits, but they don't have the means to build a house and they don't have the credit to, finance a house. So you're going to find whatever they can to have shelter. There was one situation where the individual had an old RV, and I think it was like 3 vehicles. 2 of the vehicles were stuffed high with all their stuff, but that's how they were to live. And that's their land, but it's inhabitable. So that is the big difference between federal and state definitions, which makes it hard when you're talking about service delivery, especially in the different communities when we have different barriers. I like giving this, so hopefully my drawing will be all right, but it's not going to be. So I think of homelessness as a downward spiral. And when we talk about prevention, that's kind of like here. You got the different stages. You got prevention, where they're here and they need some help to prevent that eviction. And so they're never really kind of get sucked all the way down in there, but then they don't get assistance and they go a little bit further down. And then they lose their job or there's a health crisis. Then they can go further and further down. They start to burn bridges with family members. Do you ever get frustrated? I'm a mom, so I get frustrated when I'm like, hey, can you empty the dishwasher? Hey, can you empty the dishwasher? And you're asking and I'm telling them, and you know what's best for them, and you're telling them to do these things, but they just don't listen. Sometimes that happens with other family members. There's a lot of relationships that are lost when someone is going down this spiral for whatever situation that may have started it. It's a lot easier to go down than it is up sometimes when you don't have the resources. So that's kind of what I'm trying to just create a picture, because I know it said, what does it look like? And it's not just one picture. Everything's different. I know you're talking about, medical health, and I think about feet. How many people here has ever had a pedicure? You take care of your feet because they carry you everywhere. You're touching the floor, the dirt is on your feet. It would be so nice, to have the ability to, offer those services to those that are homeless, because a lot of times you're going to find, and correct me if I'm wrong, in the wintertime especially, you go to an emergency room, there's a lot of frostbite. People lose their feet because they can't take care of it. I guess, where am I on time? Oh. I'm good, or I'm done? Time's up. Sorry.
Add to that when you listen to all of the barriers, and majority people are couch hopping, and then you add in mental health, mental illness, substance use disorder, and that just adds so many layers of complexity to that couch hopping situation, and the stability and the burning of bridges, and just that for that individual themselves being able to cope with those constant changes and the constant state of instability. Yeah, it's so much more than just a house. Yeah. Thank you.
And along with data, we know that there is also context that's really important when we're talking about any of these issues. And so today we're super grateful. We have two individuals here who have experienced being unsheltered at some point along the way, and they are now stably housed and doing well. And so I'm going to invite Marlena and Randy to come forward, and they're going to share a bit about their experience. Also, just to, and I might get this wrong, there's many experts in the room on this, but this continuum of care that's being talked about is basically these relationships. Somebody gets into a continuum of care, they go through a screening of sorts, or an intake, I should say, and then they look at those and decide, okay, where are the resources that you need to connect with, the network that's there. And so both these folks have had experience with that as well, so I'm grateful that they're willing to be here. So welcome.
Hi. I'm Marlena Josh. I'm now a board member of the COC, Hearth Connection, and a consultant for a couple state agencies. But my lived expertise, I'm also a person with lived experience, comes from rural Minnesota. So like the tent, not so much couch hopping or shelter, I don't have that experience. But I was much more like Melrose, Sauk Center, country, rural. So a lot of the services that I know these gals just talked about were not available in Melrose. You didn't hear about a motel voucher or something to get shelter for the night. So my experience then was unsheltered homelessness, rural, until I moved to St. Cloud. And then my last unsheltered homelessness in a vehicle actually led to my consulting work, which I didn't even know was a job. I thought it was a survey I was filling out as I was going through an eviction, and it turned out to be a job, and that was almost 4 years ago. So I advocate at all the state levels that I've worked at. So I've worked for the Department of Corrections, DPS. I consult right now for MDH, still DHS, stuff like that. And the thing that I always advocate for is not only collaboration at like the interstate, interagency, but collaboration with some of the things that we're talking about. The counties, the city, they all have varying levels of services and homelessness. So there needs to be collaboration between the state and the federal. That's hard, I know, but the state, the county, the city. We live in a landlord-friendly state, I think, and that makes it very difficult when you're in a court process for, say, an eviction or a foreclosure and things like that. So I always advocate for more collaboration. I don't think that at a state level, I think we can make all the rules that we want and address issues, but if a county is still doing something different with their emergency programs, services, shelters, it's not going to be effective. And that's part of what I've seen at the rural aspect, is that we don't have the services. We don't get the organizations or the agencies that you would have maybe at a metro level. So I think that creates a huge barrier on top of all the barriers that we just talked about, which are going to go anywhere. Poor credit, a criminal history, and those are all things, a background check, that pretty much are going to cover any homeless aspect, on top of the health issues of substance abuse, mental illness, disabilities, things like that. Those are pretty much, these aren't record numbers or like for sure, but I would say like that's 99% of homelessness. Those issues are involved and need services, not just shelter, but the wraparound services that we just talked about that are kind of required to make anything successful. You can shelter someone first, but if they don't get those services, they're not going to succeed. So I think I always try to bring attention to the rural aspect of this work, because I think more attention, and like I said, services need to go to that. So it's something, I advocate for. We don't just need more shelters. I mean, we do need more shelters for sure in other areas, but I think that, people always think affordable housing is the answer. Like, you hear affordable housing all the time, and we need more buildings, and that's not necessarily always the answer, because you could have what they call affordable housing and build a whole big building, but how many of those units are actually affordable housing? It's not really creating anything. And then you have the barriers that we've just talked about that are going to keep someone out of that affordable housing. The credit check, the no income, all of the things like that. So that's something that I always try to bring attention to, is the need for that collaboration. It's going to be necessary to make this effective, to make a difference. And I think that it's necessary. One of the things that I also advocate for, that I think, not the way to do it, but I think part of the answer is people like Randy and I, who are lived experience need to be in positions at the table, whether it's state, county, boards, all the relevant places, whether it's a housing navigator or a caseworker or whatever it ties into, because we really have the experience of somebody trying to receive services and know what it takes. So that's something I advocate for also, to kind of bridge the gap, or at least some of the gaps, I think is going to be a necessary component. And like I said, the collaboration at all those various levels. Like, I don't know what that would look like. I know it wouldn't be easy, but I think it's going to be necessary for effective change in some of the areas. So it's another thing I'm always on board with, is proper onboarding, mentoring, whatever you want to call it, to get people with lived experience properly trained and in these positions to create this change. And I don't think I have anything else. I didn't use 5 minutes, but that's all I got.
Some of you know me, some of you don't. My name is Randy Wickham. I guess I would be categorized as long-term homeless. I am the executive director of Lived Experience Advocacy Network, LEAN. We are a bunch of people with lived experience, kind of work together, support each other, network, do all kinds of cool stuff. I've been homeless. I guess I would call myself kind of an expert homeless person, because I've been homeless in rural areas. I've been homeless in the city. I've been homeless by myself, single. I've been homeless with my son, and I have been homeless as a teenager. Homelessness looks so much different in the rural area, and I'm glad that, Jessica, you hit on like so many things about it, because I didn't consider myself homeless in a lot of ways, because I got in fights with my family, and I was literally there was a lot of abuse, a lot of drug abuse, a lot of unsafe activities, and I would get kicked out, but I was allowed to keep my stuff at home, but I had friends that their families would kind of take me in. And I wouldn't go and talk. My teachers did not know. The close people did not know, because you don't tell people, because you're afraid that something's going to happen to your family. You're going to get taken. Your family's going to get split up. So there's a lot of secrecy about that. And I didn't even think about me being homeless as a teenager until you guys started talking about some of those things. And then I've been homeless living in a van on my buddy's property, out in the middle of nowhere, with no running water, so our van, I've been homeless in many different vehicles, and in an RV and in a trailer house with no running water, no electricity, wood stove, and we get creative. I'm sure you guys know, you've heard some of the stories of some of the people you work with, and, it's a scary thing. It's a scary thing. I guess I just want to thank you guys all for coming here, because we all know the system isn't perfect, but you guys are the ones that are doing the best you can. And there's been angels along my way that have helped me. I wouldn't be where I am today without social workers or somebody that kind of reached out to me and made me feel like I was a human being I was worth saving. I was worth working for. I get nervous. I'm starting to ramble. Does anybody have any questions? Go with that.
Share what was most helpful in terms of some of the support you got, and what maybe wasn't so helpful that people tried to help?
What was most helpful? Not being judged. Not being judged. Not being looked down upon, and actually somebody taking the time to say, to see the things, read between the lines of the things I'm not saying, and kind of like those little cheerleaders that are like, you're doing great, even like me saying right now. Somebody would say, Randy, you're doing great. Take a breath. You've got seeing the potential in me that I didn't see in myself, and going above and beyond. Yeah, and kind of, I guess, working with me. I don't know.
I don't know that I mean, I got a housing program finally that I think worked, and that was helpful. And then COVID hit and kind of screwed up my CNA that I had just got, and the schooling that I was going to go further on. That kind of got messed up. But I think that, things that haven't helped are trying to apply for emergency or housing services in my rural area. St. Cloud doesn't seem like it's that rural, but I can tell you that they don't have the services that the Metro has, or those services are not going out the way that they should. So it's not being effective to really get anyone out of a situation, even if you maybe prevent some homelessness in the moment. It's hard to get not like unbehind from that. You can keep your shelter, but you're always scrambling to catch up, or to, there's no getting ahead. So I would just say, in a lot of services I didn't hear about. So outreach would have been great if it had reached Melrose or Sauk Center when I was unsheltered there. Then maybe I could have gotten a motel room and a shower here and there, or a gas voucher, but so I think outreach, not that, I experienced and it did a lot for me, but that I think would be an answer to a rural aspect of these issues, is someone's got to go out and go, here's a list of helpful stuff, or a way to get a room or food, or so, yeah.
Any other questions?
Yeah, related to Molly's question, what are some ways that people try to help but really don't help?
When somebody pats you on the back and says, don't give up. I mean, I get that you guys are trying to support us, and also it's like, what am I going to do? Go in the corner and press the quit button, and, and I mean, that's, that's like same as like a hug when somebody's sad or whatever. But actually stopping and taking the time, asking the hard questions. I'm a survivor of domestic abuse, and I was so afraid to say out loud that my son's dad fractured my skull, and I was afraid to say those things. And if somebody didn't, I with a black eye looking uncomfortable, me not saying it out loud, if somebody hadn't took that little step and said, are you okay? I can't say the perfect words that you can say, but just sit with the uncomfortable stuff.
Outreach, where would you be, where would people be to know about this? Because I think what's happening is there's a lot of outreach, but maybe we're doing it in the wrong places.
Right. Yeah.
I understand the question. She's wondering where outreach is.
Where outreach would be most effective. I think that's going to vary community to community. And this, again, is where people with lived experience would come in handy, because they would know all those spots. It would be anywhere where there maybe is free Wi-Fi where you won't be harassed, so a public library. A food shelf would be a great outreach for a flyer, or I know the social services places, offices aren't really open anymore, but I would even say near a courthouse, or like a downtown jail, where people are going to be getting out and maybe have nowhere to go, and those services are supposed to be there. Even under a bridge, at a camping site, rural campsites, that's where I was. Various places like that where, and it's going to vary with each location, depends on what the city's got, but places like that, yeah.
Hospitals, clinics, and schools. All right, that's all I got. I just wanted to add that.
So I have two things. First of all, just thank you for your leadership and sharing today. And then secondly, Marlena, both of you spoke to the importance of lived expertise and that helping shape sort of the policies or programs. Can you talk a little bit more about what that looks like? Because sometimes people refer to it as community engagement or an aspect of equity, where people with the most knowledge about the problem are centered in developing the solution. So just want to hear what that might look like for all of us as we're thinking about how do we work together.
I think I'm always advocating for policy and procedure change. I think that just goes across the board, whether it's a state agency, each of them taking a look at it, or a county level for emergency services. I think all of those policies and procedures need to be looked at, maybe amended, maybe rewritten, just for anyone who's involved in the work. And I think that varies depending on, you know, what your organization is and what your services are. But I think then again, looking at your policies, your procedures, your prioritization, you know, if you're a service provider and you prioritize cases and that's your job, like, I think the reality of trying to get services, like your policies and procedures should reflect that and make it easier. And I think, again, people with lived experience, ask them. Like, they might not know it as, you know, policy and procedure change, but if you asked them in a manner of, like, when you tried to get services for help, like, what did that look like and what didn't work? Like, I think asking them, because they're the ones who know they're trying to get these services. So they might not see it as a policy or procedure necessarily, but if you ask them, you would know, you know.
Oh. Okay. I already forgot the question, honestly.
Wow. Let's thank you. Yeah, so important. And like Larry said, I'm so grateful for your leadership. And you just helped me remember what I was going to say. In St. Cloud, there's a colleague who keeps talking about not seeing those who are unsheltered as having so many liabilities, but how do we see that they have assets? From asset-based approach. Because seriously, they're some of the most creative people I've ever met, with the ways in which they have to get through the day-to-day, the things they have to think about, the ways in which they have to find resources. You know, they could run many of our companies probably with the way they are so resourceful. So thank you so much. And we have our next speaker on deck, all the way from St. Cloud, Minnesota. We have Deanna Hemish, who is the Executive Director of the Central Minnesota Housing Partnership. She's been in that position for 12 years as Executive Director. She's a St. Cloud State grad with degrees in horticulture? No, with degree in urban and local affairs. And she has 4 overdue books at the library right now. That's what I found. No, I'm just kidding. But we are very grateful for her leadership. She is in many places, in many areas. And so we're so grateful that it worked for her to spend some time with us. So please welcome Deanna.
All right. Well, thank you. That one. All right. So, like she said, I'm Deanna Hemish. I work with Central Minnesota Housing Partnership. I'm the Executive Director there. I've been working in the housing field for 25 years. So I've been doing it for a while. Central Minnesota Housing Partnership is a community housing development organization. We're a private nonprofit organization, and we work to assist underserved communities to, increase, improve, and preserve affordable housing, or housing that's affordable for low to moderate income families and individuals. So that's our mission. That is our region. Locally, I know we talked about a couple of cities in this region. Locally, we have West Birch Townhomes. We own and manage West Birch Estates, which is a townhome and an apartment building in Princeton. We also own and manage Meadowview Townhomes in Zimmerman. We also have Willow Grove in North Branch, which is a 20-unit severe and persistent mentally ill housing. 7 of the units there for people who are homeless. So that is kind of that's our region. Those are the housing projects we have within that area. Central Minnesota Housing Partnership, just to give you a little bit of information about what we do, we provide technical assistance to communities to address affordable housing within their community. We do affordable housing development, whether that's multifamily or single family. That includes preservation of existing rental housing or single family. We are a property management company, so we are those landlords. We do the Small Cities Development Program, which rehabs single-family, multifamily, commercial projects, so we help cities with that. We are the local Continuum of Care Coordinator, which is different than the Continuum of Care coordination that Molly was talking about. We work with service providers throughout the region, and Tim's here, so I'm very on the spot because he is our Continuum of Care Coordinator. We work with a lot of service providers and coordinate services, and he writes the big HUD, Housing and Urban Development Notice of Funding Opportunity Grant for the Central Region. We are also the Coordinated Entry Coordinator, so we manage the priority list of homeless individuals who are assessed. We manage the priority list and then refer homeless individuals and families out to openings within the community that will provide housing for homeless individuals. Again, we do affordable housing development of single family, and we are also community land trust. So we just cover a few things. So technical assistance to me is if a community is saying, we need affordable housing within our city or in our county. What can we do to help? And then I would come with something like this, saying these are the services we can provide. These are maybe it's not us that's providing those services, but someone else, and I can connect you with someone else who might be able to help address any of those needs that you might have. So that's kind of what I see technical assistance as in my world, I guess. Housing definitions. So there's a lot of different definitions for a lot of different things. Different funding sources have different definitions. So I'm just going to do some basic housing definitions here. Emergency housing, it's just a temporary place to stay. There's no lease associated with it typically. It's something that you come in, you get services, and then you're kind of out on your own. Usually you get a bed. It's not typically, not always, but it's not typically an apartment or something like that. You usually get a bed in a church or a shelter of some sort. Transitional housing, we talked a little bit about that earlier today, is an apartment or a house or something along those lines. It has a shorter term lease. You had mentioned 12 to 18 months. Sometimes they're under a year. Typically, there's support services provided with that. So they're helping that individual address any sort of barriers or provide services so that they can get into that next step, which is permanent housing, right? Permanent supportive housing is an apartment or a house. It does have a lease, but it also has support services attached to it. So they may require they can require tenants to participate in support services, but they also may not require that. So the Housing First model that they had talked about before includes someone providing permanent supportive housing and not always having the support service piece required for that individual. So there are also programs underneath there, so there's a lot of different things that move along with that, so I'll just leave it at that. Then there's permanent housing. Permanent housing includes all of the housing that has a lease. There's a length of time for this stay. Typically you sign a 1-year lease. Oh, I apologize. Thank you, Tim. He's legging me down. All right. Typically there's a lease. It does not include case management, right? So there's different types of permanent housing. So there's subsidized permanent housing. Subsidized permanent housing would be your Section 8 voucher, something that has some sort of assistance where you're only paying 30% of your income for rent, okay? Then there's affordable housing. Affordable housing doesn't necessarily mean there's assistance associated with it. It just means that the rents are lower, okay? Then there's naturally occurring affordable housing, which has no subsidies. There's no funding requirement that says you have to be affordable. This is the income limit. Naturally occurring affordable housing is typically an older apartment building, and their rents are just lower because that's what the owner or landlord state, that's the rents that they're charging. Then there's workforce housing. Workforce housing in my world is very specific to the Minnesota Housing Finance Agency Workforce Housing Program. So in that situation, you would need to have a local employer who's supporting your project, and then you could build a project that's specific for the workforce in your community, okay? And then there's just regular market rate housing that's a landlord who says, I would like to build an apartment, and they put in all of the equity, they get a mortgage, and they build the property. Typically, they're looking at doing this for the losses on the property, depreciation on the property. They're using it as a tax deduction. It's a benefit. Those are the benefits they're looking at. Okay? Now, how do we fund these things? Very, very difficult. So I had an executive director prior to me who said, if affordable housing was easy, everyone would do it. And sometimes I bang my head against the wall and say, he is so right, right? So emergency housing, it's very hard to fund this at this point. I think, because Tim and I were talking about this, the only place that I think that funds this is the Department of Human Services Office of Economic Opportunity. So I don't know of any other funding sources that really fund emergency housing anymore. The same goes with transitional housing. Very few funders will fund transitional housing, and typically it's because the supportive housing program has kind of taken the place of that, right? So housing first, getting people into that housing, providing the services they need to keep them stabilized, kind of like what we were talking about before, right? So their health, their mental health, their physical health, and everything associated with getting them a place to live first and then working on their barriers is kind of the model that people are looking at right now. So, yes. So the question was, is there any HUD funding for the first two? And I'm going to look at Tim because we did talk about this before, and he said, in very rare cases, HUD sometimes sends out a request for proposal for emergency shelters, but it's not been very often. Did I say that correctly?
Yeah, and transitional housing, they typically don't do that as a standalone. It has to be tied to a rapid rehousing program, a supportive housing, so that you're transitioning from transition into something more permanent. Yeah, it's been a change in the last few years.
Yes.
And I think the municipalities or the local counties can decide to accept HUD funding within their region as well. So that also is another piece. Sorry.
No, that's good. That's because good. I deal more with the permanent housing piece of it, so that was a little bit more than I knew. So I was learning too. Okay. Permanent housing. Permanent subsidized housing, it can be created in partnerships with other organizations. Typically, you're going to want to partner with a public housing authority and have them project-base some of the vouchers, their housing choice vouchers, where someone can get a voucher and go anywhere they want to. I can ask them, will you project base a couple of them for my project specifically? So they might come in and say, yes, I will do 4 units of vouchers for your specific project. That would be subsidized housing. Any sort of additional services, any other programs might be housing support, previously known as GRH, group residential housing, or bridges might be something along those lines. That's subsidized housing. The person's only paying 30% of their income. It's very hard to find those resources anymore. Minnesota Housing does have the Section 811 program, which also provides some rental assistance as well. So it's very hard to find those vouchers, and they're very much sought after because people are needing those, and the wait list to get on those vouchers, to get a voucher, very, very long. Several years depending on what county you're in. Permanent affordable housing is, again, we were talking about that with, it's just housing that's affordable to the local counties. I apply typically to Minnesota Housing Finance Agency. I have applied to Federal Home Loan Bank. I've applied to Greater Minnesota Housing Fund, different funding sources, local banks. The low-income housing tax credit program is probably the biggest contributor to the affordable housing development in the nation. So, and that's an IRS program, so that's very interesting. Let's see, naturally occurring affordable housing. This would be if I wanted to come in and go and purchase an apartment building that was already affordable and then keep it affordable. Minnesota Housing Finance Agency has some dollars for that, as well as Greater Minnesota Housing Fund. So there are some areas there. You could also do it through a local bank and then keep it affordable. The workforce housing program, again, specifically, that is a Minnesota Housing Finance Agency product. So you would have to apply to them. They have funding rounds typically once a year, or every other year, every biennium. And there's not a lot of money for that program specifically, so it's very much sought after. And again, you must have an employer involved in that program. And then there's market rate housing. Market rate housing, an investor's going to invest in their own project, they'll get a local bank, and then they'll build it themselves. So that's typically how these things get funded. And then, what do I have here? What types of housing, what kind of partners should be at the table when you're looking at affordable housing and different things? We talked about a lot of them, right? So you want a developer, someone who's going to be able to do the development, apply for the funding, package the deal. A builder, an architect, city administration. In any sort of affordable housing projects, you're going to want the city to participate. It makes your application stronger and increases your chances of getting funded, because that is a very competitive program. The applications are due in July, funding announcements are made in December, and about 1 in 5 applications get funded. So it's very, very competitive. County administration, every county got state affordable housing aid, so there is the ability to maybe tap into those dollars to develop affordable housing. Funders, Minnesota Housing Finance Agency, Greater Minnesota Housing Fund, we discussed a lot of those. Sellers of land, so realtors, that is the hardest thing to come across on projects, is finding the land that is in a good location, that meets the needs and those sorts of things. And is access to transportation, big deal. Investors, employers, all of these we kind of talked about. A market analysis consultant, what's the need in the area? How big should we make the project? What should the rents be? What can the market support? Community supporters. The biggest thing I have found is that if I have one person in a community who is the cheerleader, they are able to do so much that I can't do as an outsider coming in. So if I have a cheerleader, I will use my project in Eagle Bend. I have Verna in Eagle Bend, and I say, Verna, I need this. I need you to raise $150,000 in 3 weeks. I did that to her. I felt super bad about that. But Verna raised $155,000 in 3 weeks to support that project. So those local people, very important to get to know, because they know people that you don't know, and they will figure out ways to help support your project. So public housing authorities, we talked about that. Local nonprofits, here's the big one, service providers. There are not a lot of service providers in Greater Minnesota. So finding a service provider who's able to do the work and be available for tenants, especially our homeless tenants that are moving in, that's super important to have. Banks, again, surveyors, environmental companies, but be creative. I think that's the biggest thing. Try to think outside the box, figure out ways to fund different projects in different ways. So those are kind of the people you want to keep at the table, or at least start the conversation with. And now the myths, the Mythbusters. It takes a long time to develop housing. I will submit an application again in July, but I've already been working on that application for several months, probably 6 to 8 months already. Submitted in July, you don't hear about it till December. It takes another year to close, and then you construct the project, which takes 15 months. You're looking at start to finish from the beginning. It's 3 years. So we have a housing need now, but I can't address it until 3 years from now. So that's a hard thing for people to understand. Well, I need it now, and I understand that, but I can only do so much. And that's assuming I get funded. Again, that's a 1 in 5 chance I get funded. So how am I going to package that deal, make it competitive, and be able to provide the needed housing within that community? There is no evidence that multifamily housing or affordable housing will decrease the value of other housing in the neighborhood. I have had that conversation with several people. I have had St. Cloud State students do some research on that. There is no correlation between negative values of your house next to an affordable housing rental property. So that is not true. Subsidized housing is affordable housing, but affordable housing is not always subsidized housing. People like to use those interchangeably, and so you have to kind of dig deep into what they're trying to say in order to get through that. Okay, what are you really looking for here? Most tenants who live in affordable housing projects are from the surrounding area. I don't market my vacancies in Chicago. I don't market my vacancies in Minneapolis. The people who are moving into these properties that we are building are local people. It is very true. There might be some that move to the area, but they're moving there for a job, or they're moving there because of the services, or they're moving there, but they're relatively local within the county or within the surrounding county. We're not pulling people from different states or different counties to live at these properties. And believe it or not, landlords are not always bad guys. That was one we talked about a little bit, but we're not always the bad guys. We do have the laws and the requirements that we have to abide by, but we don't want to see vacant units either. So we will try to work with landlords. We will try to tenants. We will try to work with people because it's easier for us to keep people housed than it is for us to have a unit become vacant, clean up the unit, rent the unit again. It's very costly for us too. So it is in our benefit to keep people in their housing as well. So, and then I'll show you a couple pictures of different projects. And this is White Oak Estates. It was built in Baxter. We have 20 units of family housing, that's the townhomes, and 20 units of supportive housing units. There are 7 homeless units set aside in that. The 20 units of supportive housing, people have to have a severe persistent mental illness in order to live there. The services there, we do not provide services. We contract with other people to provide services. Lutheran Social Services is our service provider at that property. The project was constructed and completed in December of 2020. There are 10 funding sources that financed the development of this property. So I was like, yeah, it's no big deal. But when I was talking to Tim, he thought that was very interesting. So I said, okay, let's go over that. So, yeah.
There are a certain amount of units set aside for homeless.
Yes.
Yes. Is that going to be permanent, or is that tied to a TIF component?
Okay. So the question was, is the 7 units of homeless permanent, or is it tied to a TIF component? We did get tax increment financing on this. The homeless units are not associated with that at all. It was a funding requirement, so we did apply for funding, stating that we are setting aside 7 of the units as permanent supportive housing for homeless people. So funding sources. We have 10 funding sources in this project. There's the first mortgage, the equity from the investors, the sales tax rebate, the energy rebate, the FFCC funds, which is a deferred loan, home funds, National Housing Trust funds. Both of those are federally funded. There is local banks contributed $250,000 to the project because they supported the project. We had local contributions from other sources, and then we deferred a portion of our developer fee to make the numbers work. So we have a $10 million project here. Every one of those funding sources on there have a different requirement. So when we are talking about the definitions of homelessness, some of the homeless units are long-term homeless. Some of them are high priority homeless. I don't have any HUD funding. Otherwise, there could be chronic homeless in there. Every one of those has a different requirement. So as someone who is homeless and they're saying, I need housing, well, yeah, you fit this box, but you don't fit this box, and my funding will only do this. So I can't put you into this housing, even though you're homeless. So that it doesn't all jive together, and the funding sources are all different. So the home funds have different income limits. You can go down to 50%. Some of the units have to be at 50%. Some can go up to 80%, but my tax credits are 60%. So I have to figure out all of these different requirements, see which one of them is the most restrictive, and that is my new requirement for everyone moving into that property. So it does make it, when I sent this to our compliance team, they weren't necessarily super happy with me. And actually, Minnesota Housing Finance Agency, I was talking about this at a different project, and one of the underwriters came up to me and said, yeah, I underwrote that one. Sorry about that. So, yeah, it's a lot. But it provided the housing that was needed, right? So that's really the key takeaway on this. We'll figure out the do's and don'ts and what needs to be done, but the biggest thing is it provided the needed housing. Heritage Court in North Branch, this is a 32-unit senior project we just completed in December of 2022. There were only 3 funding sources in this one. So, and then this is our newest one. This is Creekside Manor in Buffalo. Again, this is a senior complex. There are only 4 funding sources in that, and that one was just completed in June of 2024. So if you know anyone who needs housing in Buffalo, we have a couple more vacant units for that 30% income level. So the other thing that I talked to Molly about right before we got on here was the State Housing Tax Credit Program, which is a new program provided by Minnesota Housing Finance Agency, and that allows people within the community to invest in a specific project in your community. So if we were doing a new project in Princeton, I could say, hey, I'm leveraging dollars locally, and I was wondering if anyone would be interested in investing in my project in Princeton. I'd maybe go to local banks or investors or people who maybe need some tax write-offs. I would go to them and say, you can invest in this project and get a state tax credit on your tax credits, an 85% tax credit on your state credits, and then that would leverage dollars for specific projects. So that's a very important tool that is out right now. It has a 4-year funding cycle, so let's make sure that we're utilizing it and keep it going so that we can continue to get those funds or that source of funds as an ongoing source for different housing projects throughout the region. Other than that, I am done. Mic drop.
Things I would say point out too though is with the different emergency, transitional, and
Permanent and affordable.
Well, the first 2, there's a lot of zoning requirements for those, and so that's the challenge. And so that's when you have to have good relationships with your city and your counties to try to figure out how you're going to adjust. Like the emergency one can't be has to be more than like a quarter mile away from group housing or sometimes schools or things like that. And one city might have that and the other city won't. Okay, so in St. Cloud it's challenging. We have 5 cities and 3 counties, so you can imagine how kind of crazy that gets. But it can be done. But it's just that is another layer to this, is some of that zoning, those zoning issues. I'm really glad that Deanna mentioned that housing credit, because that to me is like a no-brainer. Like all of us could, on our taxes this year, go into that personally and say, I want to put $100 towards the Buffalo project with Central Minnesota Housing Project, and then I get 85 of that back. Yeah, no, 80. Yep. Oh. Do you want to come and say something about that? Or is that?
Do you want? Hi, everybody.
Alyssa, why don't you come down this way? Yes. We're super grateful that we have somebody from the state with us today, and welcome to you. And yeah, if you want to just say something about that.
Good morning. Nice to see you, Deanna. Nice to see you, Marlena. So my name's Alyssa. I'm with Minnesota Housing. Thank you for the invitation. Honestly, I really love being able to just sit and listen and hear what's going on, because every community is really special and has unique challenges as well. So just with the state housing tax credit, it's new, it's kind of complicated. So I'm excited about the opportunities just for your own kind of due diligence. Like I advise, like go to the website, maybe talk to a tax advisor. There's a couple tricky things around the timing of the project selection. So sometimes if the project isn't selected, there's just a general fund that will also be open for application. So more just a caveat of the like disclaimer, just make sure you check out kind of what all the iterations are. We have the programs on our website. We have a contact for questions. So I just felt more like disclaimer than not to be the wet blanket, but just we heard from one community where it didn't work out, and I think they were really disappointed. So, but the good thing is there's a lot more flexibility and ways to support housing in your communities that are kind of outside of these super competitive processes. So,
Can I speak on the spot for a minute?
of course, yeah.
What would you say is the most important thing for communities like ours to do to organize to try to get some of these projects? What's been most helpful?
Well, I mean, the biggest, I feel like this is, you know more than me. I mean, I do, but the community support thing is huge, right? Like getting that support, both the financial, but then also kind of lining up the approval processes, the zoning. You know, to your point, there can be some fear of change or some kind of misperceptions of the housing when actually it solves the problem, right? Like if you don't have a home, now there's home. So I really think the champion piece is what I often hear is like really getting that lined up is a big deal. So yeah, it takes a lot of time, but it's the state housing tax credit. And so there's information on our website. Trying to think anything else.
As a developer, you can market your specific project on the website, and then you can link to that directly. So that as a developer, I don't want you to put too much. I don't want you to address your timing issue. I wouldn't put it on until I thought I could use the money, leverage the money for my application, and still utilize it within that 2-year time frame, because there is a 2-year time frame to access it. So I would look at the specific website to see if the project is listed first.
What's the website?
So it's mnhousing.gov, and then you can just search state housing tax credit, and it'll take you right there. I don't want to take over. But real quick to your point about how to support the housing, it is a complicated scoring, like trying to align a lot of different priorities into one process. And so like where the specific property is going to be built within the community, like you said, there's more points if it's near services or transit or certain kinds of things. And so if the zoning doesn't allow it to be built there, then you're kind of losing that opportunity to get those additional points for the particular. It's that specific sometimes around those access points. And did want to give a shout out for including people with lived expertise in your processes. I know at Minnesota Housing, we've just shout out to Marlene if it's okay if I call you out. You know, like she helped us score applications for a grant that I managed a couple years ago. There's like strategic planning processes. I know the Minnesota Interagency Council on Homelessness did this massive Crossroads to Justice plan to really set out a path to address homelessness. So I just, if you're gonna spend all this time and resources as a community, like design it with the people that really know how to solve the problem. So just an additional shout out for that, the importance of those leaders in your processes. So thanks for the impromptu.
Yes, that's great. Yeah, thanks both to Alyssa and to Deanna and Pauline. One question? Yeah.
Sorry. So are you continually just always have a project going, or are you looking for partners, or
Well, see, that's the dream, right? To always have a project going. Yeah, that is the ideal way to go. But again, it a lot of times depends on funding and how to put all those pieces together in order to make a competitive application, and then hope that other people's applications aren't as competitive as mine, or at least I hit the threshold that it's just as competitive. So yeah, that is always the goal. So if communities are looking for that, I will go out and talk to them and say, okay, here's where we're at, or this is how I can help, or I might not be able to do it this time, or we have a year's worth of work to do before we can get to that application, and we will sit there and work with them on trying to figure out all of the pieces to make the strongest application. Yes.
That you have built, I mean, I'm assuming except for the senior one, maybe they just fill up fast, right?
Yeah, typically they do. Depends. I mean, I have some in very small communities like Eden Valley, Minnesota, very small community. We have 2 apartment buildings there, actually. One is subsidized and one is not. So it depends on the location and what the income limits are for our programs too. So yeah, good question. Yes, Tim.
I'm just wondering, in your myth busting piece of things, I'm wondering if there's kind of a myth that you build it, walk away, and everything goes.
Oh yeah.
Right? But I wonder if a minute or two of just, and then what? It's running, it's up, all the reporting and all the things that you have to do just to keep it going.
Yeah. So I'm the executive director, and so I do a lot of the development side of things. But my other hat, I say 50% of my time is overseeing the property management department, and we have a director that oversees that. So, you build it, and then you have to fill it, and you have to make sure that everyone complies. So that is third-party verifications of income, making sure that you're verifying their assets, making sure that they income qualify to live in that property, and then that they can afford to pay that rent. Because like I said before, we don't have a lot of subsidized housing. We have affordable housing. So the rent still might be $850. So can they afford that based on what they have? We will always take Section 8 vouchers. We will always take any sort of subsidy that will assist them to afford that. And then we don't look at their ability to pay. We don't look at their credit. On our homeless units, we have a whole separate screening criteria for our homeless units. So there's a lot of different pieces with that in just filling the units. Then after they're filled, we need to make sure that the property's running smoothly, that I'm cash flowing the property, that I'm not having to advance money. CMHP is not having to advance money to a property because they can't pay their bills because we have vacant units or the rents aren't high enough or something along those lines. And then after that, there's the compliance piece. Minnesota Housing Finance Agency requires that we submit annual reports to them based on who we're renting to. In addition to that, our tax credit investors will come out. They will look at that. They'll look at our file. They will inspect the units. Minnesota Housing comes out and does a inspection of units. If it's funded in any part through the Department of Housing and Urban Development, there's a REAC inspection that goes along with it, which is very intense. And then you have to score certain amounts. You have to fix things in certain time frames. You have to provide documentation for that. So it does continue to get extremely cumbersome as we continue to move on. But that's where you need good staff to make sure that everything is trying to be is running smoothly and that we are maintaining and complying with the requirements set forth in our funding, the funds that we receive to build the property. Yes.
I find it frustrating that because you need to have cities that will work with these ideas and putting up the affordable housing properties, but they get such pushback from the community because NIMBYism kicks in. Because the minute you mention affordable housing, people automatically think we don't want those people here. And you're talking about you don't want a police officer who's starting in his career, or a teacher, or someone who's just coming out of schooling and starting their career. That's what you don't want here. I mean, it's just so frustrating that you work against that. There again, we're talking about misinformation, misnomers, and how you get a community behind these projects, because they're really great projects.
Yeah. I'm going to bring you to all my city council meetings. But yes, that's.
Yes. I've sat at that dais and had that.
Yes.
Those pushbacks.
The pushback on not in my backyard. I don't want to bring those people here. And the education piece about, okay, well, we're talking about people with incomes at $32,000. That is your grocery store people. Those are the people that are doing retail. Those are sometimes your teachers, especially if, and this was interesting because I talked to a healthcare organization previously too, and I said, this is your nurses. And they said, no, we pay our nurses very, very well. They can't live in your affordable housing. And I said, I will guarantee you that a nurse that works for your organization lives at my housing because they are a single mom with 2 kids, and they're still paying off their debt, but they're a single mom with 2 kids. So they don't have dual income. They have their income, and their income qualifies for the low-income housing tax credit program. So
Also advocate for the housing projects that provide the opportunity to give some stable homes and housing to people that are in a bad way or trying to get on their feet.
Yep.
That is what we should be doing as well.
Yes. Yep. Supporting those who are trying to overcome barriers. Yep. And that support service piece in those is so very important. And it is optional, especially in the Housing First model, like they had discussed before. But it is so important that if a person who is in a permanent supportive housing project of ours is not taking the services, that's their right. But if they break a lease or they're not paying the rent on time, we might encourage them, maybe you should go talk to so-and-so in the office and maybe reconnect with them. Maybe they can help you with some resources or things like that. So trying to reconnect them back to those support services is so very important for people who are trying to overcome barriers. Yep.
Thank everybody in this room for being here to help solve this problem or help make an advancement on the issue.
Amen. Thanks, Deanna, so much. That was great. All right, we are. You get a 1 minute 30-second break. I'm just kidding. No, let's take 5 minutes. Okay, just 5 minutes. You can restrooms and drinks and. There is a full bar in there. We can't have access to it. So sorry this morning. But also, you can chat with some of these people, too, if you need to.
So Ty's mom is moving to Zimmerman now.
By the time I relaxed, time was up.
Welcome back, everyone. Hopefully you were able to take a quick little break there. And again, thank you for being here today at the summit. As previously mentioned, my name is Emily Carpenter. I'm on staff with Fairview and have been a part of the planning committee. So it has been many months where we've met to really think about how to create the most value in the 3 hours that we have together today. And I've been sitting and listening, and it has just been such rich content. So thank you again to all of our presenters. Thank you to everyone for being in attendance here today. The next portion of our event is going to be a panel, so come on up, one of our perfect timing. And this is really a panel to talk about civic response. So we have 5 leaders from the Rum River area that are going to share a little bit more on behalf of their organizations. And so really I'm going to turn it over to them and ask all of you to each share for just a few minutes. First share about what resources your agency has available to the community. So I'll really leave it at that. And if you haven't had the opportunity to introduce yourselves to the group yet, I'll invite you to do so. Would you like to start?
Is that okay?
Should I start with
Is that okay? Because I was told I was going to be going last. So, all right. This is how adaptable we are as service providers. My name is Jessica. I work for Lakes and Pines. We are a community action council. So we provide services that are geared towards those that are living in poverty or close in the poverty guidelines, and the services provided are geared to help them make ends meet. So just to kind of briefly talk about the program services, we have a community services department, which I'm a part of. And in that department, we have our SNAP assisters. So we do have somebody who is able to assist households in applying for SNAP over the phone. They complete the application with them. They still have to do the hand signature and then have it submitted. Last year, there was 172 households that were able to obtain food support benefits. We also have a MNsure navigator, who again is someone who assists individuals who are applying for medical assistance. They can help them create an online account, go through the application process, and help them get insurance. Last year, there was 121 households that obtained health insurance. We do have a SNAP and E&T program, which after an individual applies for the SNAP and they're eligible for some employment and training services, they can connect with them to help them increase their employee skills or employabilities. 59 households we've helped 59 households last year to increase their employment skills. We also have someone there who assists with Social Security application assistance. She is probably the person I would go to if you have any Social Security questions about any of their programs. She can help them to gather those documents because there's a lot of documents. It's the federal government. They want everything. So she really helps them navigate through that process. And last year we had 16 applications, complete applications that were submitted. And through that process, there was about 6 individuals that obtained Social Security disability through that time frame. If anybody knows, it's not a quick process. So having 16 applications submitted is pretty fantastic. We also have the FAME program, which is developed to help families invest in whether it be school or new vehicle, home ownership, or starting a business. This is a program where they would take some financial literacy courses and also be able to commit to typically a year to 2-year contract of putting away money. So that could be $50, and that would be matched up to 3 times. So last year we had 5 households that were enrolled, and it is limited space. Financial fitness, again, that is connecting with someone who really kind of goes through your finances, helps you budget, help you create a spending plan, see where you can maybe connect with resources to help offset costs other ways. And we helped 27 households improving their financial fitness last year. Vita Tax, so it's a volunteer tax program that we have we do every year, and last year we helped with 629 federal returns, 598 state returns, and then 351 the Minnesota 1 PR form, and 448 property tax returns, which equaled over to $1 million in refunds to filers in their households. Motel vouchers through the ESP program, we assist 160 households. Eviction prevention and mortgage, we assisted 256 households. And one thing with those pieces, we helped 154 households who came to us homeless obtain housing. And so that's our community service department. We also do have our weatherization department and energy assistance. I don't have numbers because it's not my department, but part of that is it's energy assistance is for those families who qualify to receive a grant during the winter season to help offset the costs of their heat, because obviously the costs are not going down. And so that really is helpful. And if they qualify for that and say they have their boiler breakdown, they can call, and we have a program between energy assistance and the weatherization where someone will come out and help fix it. Or if they don't have a sufficient heating system, they can come out and help put a sufficient heating system in there. There's other things that we've been able to do through the weatherization in our rehab programs, where looking at safety and health and wellness to be able to do some smaller scale rehab loans for families as well. So, yes, we are a community action council. So, there you go.
Oh no. Okay.
Don't take the entire time.
No, I'll try not to. Well, I have probably a quarter of that. So my name is Brandon Higgins. I am with Unified Social Services. So currently right now the services we provide are MNsure navigation, housing stabilization services, and housing supportive services. I'm also a board member of Lakes and Pines, so if you have any comments to make about Jessica's presentation, you can let me know. So right now we're operating out of the, only one of the counties here for the Rum River, so Mille Lacs County currently. I did just reach out to Isanti and Chisago counties, and we'll be hopefully entering into a agreement with them coming up here for housing supports. We have currently 10 properties right now that we are providing supportive services out of. Unfortunately, again, only one of those properties are here in the Mille Lacs County area, and that is the Bellhaven Townhomes. That is 17 townhome units. Currently right now, I believe 14 of which are receiving supportive services out of. So that's definitely a big number as far as much needed in the area. And then we have 2 new builds also coming. Unfortunately, again, not in the Mille Lacs County area or Sherburne County area. One's in Rockford, so the Hennepin County side, that is the Enclave Apartments, and then one in St. Joe, and that is Viewpoint. So those will both be, I believe, 9 units each. That'll be dedicated to supportive housing, so LTH will be needed in order to qualify for those units. Oh boy, long-term homeless. So they will need to meet, I think it's only 5 of which need to meet LTH, and the other 4 are high priority homeless. So exciting to have those new builds in that partnership. Yes, Amanda. Oh yes. Yep. So we just recently also got approved for 2 scattered sites. Scattered sites are just kind of more scattered about within Mille Lacs County. So we're able to work with any property manager that's willing to accept the fund. I know that a lot of neighboring counties have had some hiccups with finding sites that are willing to work with the scattered sites. Hopefully we will not have that same issue here. So I kind of did not want to steal the show, so I will pass it along to Sydney. So.
All right, I'll be brief because you already know a little bit about Open Doors for Youth, but just to add to what I said earlier, as a drop-in center, my goal really is that we can, to the best of our ability, provide a one-stop shop for the youth that come to us. So we provide a safe space where they can be accepted no matter what, no judgments, and they can just have a safe space to relax for the afternoon. They have immediate access to all of the basic needs. We've got a food shelf and a clothing closet. We've got hygiene products and additional basic needs. And then we have staff that will sit and talk with youth about what are your short-term needs, what are your long-term needs. We're very much youth-led, and so we have the youth sit down and tell us what they feel like they need to work on to improve their situation. Then our job really is to come alongside them and help them make progress on those goals. We have area service providers coming in, most of them on a monthly basis, so they know that they can come in on a certain day, and Maurice from Central Minnesota Jobs and Training is going to be there, and he can help them obtain employment. We used to have an outreach person from Catholic Charities once a month. They're looking to fill that position still, but again, creating that space where they can come in, they know they can get have access to immediate needs, basic needs, and then have folks there that can help them work on long-term needs. We provide mental health support on a weekly basis, free of charge. They don't need insurance. They don't need to go through a lengthy intake process. They can walk in and see a therapist every Tuesday afternoon. Can you say? Sorry. We also go out into some of the area high schools and do outreach in that way. We're in Princeton on a weekly basis at the ALC and at the traditional high school here in Princeton. Staff comes up, and then we also have a therapist that comes up with that staff member, again, providing outreach services, providing therapy to youth that we see in this community. And then we are in other area high schools on an as-needed basis. I'm going to stop there.
Thank you, Cindy.
Can I ask a clarifying question? You had 447 youth and the 7,000 visits. Was that since you were open?
Yes.
Okay, got it.
Yes.
All right. I am Heather Cleaver. I am the Executive Director at Care Food Shelf in Elk River. Care Food Shelf, we are a client choice-based food shelf without borders is kind of, I feel like it's becoming more the norm. That's what we all should be, all of our food shelves. If somebody comes in and they're from Fairmont, we don't need to have proof of their address. We don't need to know anything else other than their address and how many people are in their household. I will ask, why? There's probably something closer. Well, this family is caring for a sick mother that is in Elk River, and so it has been helpful for them to be able to use Care to supplement that drive time, all that. But again, we don't need to know. I did a count yesterday as I'm preparing for a grant, and I really leery about giving this number, but I counted 77 zip codes that we have served in 2023. So it's they come from all over. People are in need of help, and so we are there. Again, it's a client choice. We are a super shelf, so we make sure the healthy choice is the first choice, the easy choice, getting that good food to families in need. Aside from our food shelf, we also do some financial assistance, and so I think that's why I was brought here is we do provide rent, utility assistance, car repairs. So rent assistance this year to date, Ashley, 67 families that we pay 1 month of rent. Now we do have more. We do have borders on that. That is going to be Elk River, Otsego, Zimmerman, Big Lake, and Becker. Princeton's been such a hard one because I want to be able to do that, but it's not. And the money is hard. Rent is expensive. I mean, when you say $800, that's not what we're seeing. And we've been able to help with mortgage too. So it's just nice to know we're not alone. So I appreciate all of that. And then of course the utility assistance until, energy assistance is starting. That has been 70 some households this year that we've helped with energy assistance. And car repairs, trying to make sure they're able to get to work and making sure that they have that reliable transportation. So we work with other agencies to make sure that we're all, they've exhausted the resources at the county or they don't qualify for that resource at the county. We work with St. Vincent de Paul has been a great one. Maybe the county can pay and we can pay. They're behind 3 months. So someone pays 1 month, we pay 1 month, they pay another month. So we do try to work together and make sure that we're all covering the bases and keeping people housed. Thank you.
And you spell CARE the wrong way. So what do those letters stand for?
CARE was started in 1979 by 12 area churches, and they started it as Community Aid Elk River. So I don't want to change the name, but we definitely serve more than just Elk River. So that is why it is Community Aid CARE.
Thank you. All right. Again, Molly Wyrens from Christ Our Light Church, and one of my hats that I have at the church is to connect with people who come to our doors seeking assistance. So we're very fortunate in our community. I think we've come together well. We have a group called Princeton Community Care that is about... Spell it right. Nice. I like that. We do. PCC. For short. And so we gather together about 6 or 7 of the churches in town and just kind of talk about what's going on. We work on a couple of things together, one of which is our Christmas giving program going on right now, and that's community-wide, and it's between 80 and 100 families that we'll supply presents and gas and grocery things for. And we do a Day of Kindness, which is in August. And then another thing, which some of you might be aware of or not, and we do this in Zimmerman as well, is we host Laundry Love, and Laundry Love is a national organization, and it provides quarters and supplies to people to just show up and they can do their laundry. And that's been a great thing just in terms of just connecting with people too a bit and hearing more about what they might need. But anybody can start a Laundry Love. So if you're in a community and you think that'd be a great idea, I highly suggest it, because we had a woman call from I think Woodbury the other day, and she had 5 kids, single mom, and a ton of laundry, and she said, I have nowhere. And I'm looking on the website, and there really wasn't anything listed down there. So so great thing. But one of the things we've also been doing in our assistance is working together, like Heather has been, in terms of, somebody comes in, needs $1,200 for their rent. I'll say, hey, you need to, make a couple phone calls, and maybe the 4 or 5 churches or however many can come together and help you with that. We're not going to be able to cover that whole thing, but we can cover some of that. I also want to say thanks to Unified Social Services with Amanda and Brandon, because that has been huge. So nice to be able to just have another resource for people to call. So that makes a huge difference. And when we talk to them, it's not just, okay, here's $1,000. It's like, hey, what's going on? How'd you get to this place? What are you connected to already? Letting them know about other resources, contact people. So we're also trying to connect them to resources as well. We have our own continuum of care. So there. And just some numbers, though. It's pretty staggering. So I asked a couple of the churches, and Pastor Jake, I'm sorry, I did not reach out to you guys, but you might be able to formulate a little bit in your head. And Lorraine, 2 pastors from Zimmerman, and those of us in Princeton. So New Life Church here in town, in 2023, between hotel vouchers and rent or utilities, food, cards, gas cards. Last year, there were 58 families with about $9,100. Okay, $9,000. This year so far, is that from July or from January? Okay. So since January, they're up to 7,600 this year. Trinity Lutheran here in town, last year about $5,000. Between those various components. Bethel contributed so far this year, and I'm not sure if it's January or July, $1,060 so far. Souls Church, they say they get about 5 to 10 requests from people, and the amount they request ranges anywhere from $100 to $500 in need. They do a lot with their own congregation members, so they're not able maybe to help as much with some of the outside folks coming in. Christ Our Light, between all those things, last year we were at close to $11,000 that we supported people with, and then so far this year we're at $4,000. So that's a lot of money going out between various churches. And imagine what we could do with some of those funds to put toward a project, maybe, right? Or, it's always going to be a little bit of that. We're very grateful that here in Princeton, the hotel owner is willing to house folks for us. We're hoping to make a connection with another hotel owner in town. But really, this is a glut for there's no shelter around. Pine City is our close, well, not close. I don't know if St. Cloud or Pine City is closer. But those would be the 2 places that we would offer to send people to. But again, we have no transportation there, So I talked to a woman yesterday. She's 61. Boyfriend is 71. They both have disabilities. She's had cancer 3 times. They're traveling on bikes. They're trying to find housing. Had a lead in Mora with a mobile home. It fell through. There's storage units in Mora. That's going to be, another month or so of support there that they're going to have their things. But just, so she was in tears on the phone just saying, it's really getting cold and it's been a rainy week, right? So, Jake or Lorraine, did you want to say anything about your support? I didn't want to leave you out.
Oh, no, I don't know if we have numbers. We're obviously a smaller congregation in Zimmerman, so between supporting Laundry Love and then also, I would say we probably had rent needs or food needs or help with just groceries. So it's been a smaller number anyway, between maybe 5 to 10 in that range, families and stuff, but we do smaller dollar. So
right. But absolutely. Yep. No, it all makes a difference. Yeah. No, Jake?
We like Laundry Love. I've had someone help with that in the past, not at the moment. We have a food pantry, very active and growing pantry, serving about 55 families every Thursday morning in Zimmerman. And then Dennis Bishop is our head elder. He's here with me today. And we have a benevolence fund that is used quite a bit at times. And I think right now our balance is quite low. We've been fairly active. It took a jump. So
Yep.
Took a jump now.
Yep.
What church are you from?
Faith Community Lutheran. I'm Zimmerman, 1 mile south of town.
Great.
Well, thank you to all of our panelists for sharing a little bit more about resources. And I resonate with the comment, we're all doing what we can, right? And so it's great to hear about what resources are available. I know we're tight on time, but we did have another question for the panelists. And so we may not go with everyone, but I do want to still offer up this question, which I think leads really well into the next portion, which is our discussion. Also going to swipe my computer so we don't lose this. Okay. And the next question was all about, was really to get at what, we know that there are many resources out there. We've talked about that today. We've talked about and learned together about what exists, right? And at the same time, there's limitations and there's gaps. And so it was really to get at what do you see from your viewpoint, from your organization? What are those limitations and gaps? And as I've been listening today, some of them that I've heard are, and these are really big buckets, right? But I think we've gotten to dissect those big buckets a little bit. I've heard financial limitations, time, geographic, where you can and can't go, right? What resources may exist already? Transportation, Molly just brought up as well. So what I would ask is, in addition to what I just shared or what we've heard today, as far as the limitations or gaps as we think about safe and affordable housing in the Rum River area, is there anything else that you'd like to add that you feel like hasn't been touched on already? Anyone? Mental health. Mental health. Thank you. Yep. Daycare.
I feel like daycare is a big thing. I mean, transportation is, but if you want to get to work, you talked about the single mom nurse. Where's she going to bring her children for daycare? That's affordable. She's going to be paying as much as her salary probably in those daycare costs for a while. So it's something, and there's not a lot available.
I think this has probably already been, talked about, but to just reiterate the lack of options for housing, for emergency shelters, for transitional housing, there just isn't enough. And there isn't enough, sounds like there isn't enough funding to support, I mean, I can speak from my own experience, the lack of funding to support those housing options. And we're all doing a lot of really great work, and we all have buckets of funding to fill those gaps and to help with eviction prevention. But what would it be like if all of that money that we're all spending individually for kind of Band-Aids, to some degree, what would it be like if we banded together and pooled all those funds together to create something a little more sustainable?
I think another thing too is just education. I think there's a lot of people who don't think all this is happening in our area. So I reached out yesterday to the school district here in Princeton, and they said there are about 15 or 20 youth currently who are homeless. I'm sure that number's higher because, like Randy, you were saying, like people don't think that they're homeless or they don't put themselves in that box a little bit. And just making businesses aware, bankers aware, all those folks who need to be involved in this. I think when these numbers kind of start coming, people are like, whoa, this is heavy, this is big. I remember we just did a thing on homelessness and youth at church, and I heard for months after that people saying, Molly, I cannot believe, that is crazy. And I'm like, yeah, that's what we're talking about. That's why we got to figure stuff out so we can help these folks. So education.
So I just, to kind of basically agree with all the things that have been said, but, going along with the education is about really the communities and society looking at it as a society issue, not a personal issue. And with that being said, it trickles down when we don't accept it as a societal issue. It trickles down into the services that we're able to provide and the services that are created actually meeting the needs of the individuals that need it. I know, Deanna, you talked about all those different particular things that you have to meet for someone to be eligible. It's just like the services. You have to be this before you can get this. There's not a lot of preventative. It's very reactive. Until it happens, nobody realizes it. Until it happens to them, they didn't know it was true. And so I think a lot of that education out in the community, the acceptance that it's a society issue, not a personal individual issue, and understanding. And the willingness to be able to, when you do see someone, or you even, walking on the streets and saying hello to someone, and accepting everybody for who they are and their own experiences, and not trying to put, say my own personal values and my experiences on that person that I'm talking to today, because it has nothing to do with me. So I think that also.
Thank you, and thank you all. And I'll say, to start to transition us into the next portion, that's really what we're getting at here. What the panelists are starting to talk about is the purpose. When I go back to why did we decide we wanted to host a housing summit today? And it wasn't, the goal isn't to have a one and done event and have this great robust conversation and discussions and information, but what can we do from there? And so in just a moment, I'll have Molly kind of tee up our next section, which will be having some small group discussions to really think through some questions that our committee has developed, and then invite you to be a part of this conversation outside of our 3-hour event. So before we get to that, can we give a big round of applause to our 5 panelists? And I'll turn it over to Molly.
All right, so if you can just listen, I'm going to give you a number quick, okay? So Pauline, or is it Bradley? Bradley, you're 1, 1, 1, 1, 1, okay? 2, 2, 2, 2, 2, okay? 3, 3, 3, 3, 3, 4, 4, 4, 4, 4, 5, 5, 5. Heather, you're a 5. Brendan, you're a 5. And I'm going to go 1, 2, 3, 4, 5. Okay? So what we need is one representative from each of those groups to come forward to grab these sheets of paper and a marker and some questions. So you're going to get into your group. You can go anywhere in this building, okay? So you can go on a nice island and do your work, okay? Please don't get markers on the island, marks. That would not be good. And we're going to have 3 questions up here. What have you heard that struck you? From what you've heard, what are possible next steps that you think might be appropriate? And then who are the important partners that need to be around to make that happen? And there's also a list right here. Can you throw that up there? List of these are who's represented today, okay? So when you look at that list, maybe if you want to take a picture of that, because then when you get back to your group, you can say, you know what? We're missing bankers. I mean, that's one we're missing, I think. Or who is it that we're missing, okay? So any questions? We are only doing this for about 20 minutes, and then we're going to come back here, and then we're going to wrap up, okay? So any questions from anyone? Yeah, and you'll get those in your groups. Yes, yep, I have a copy of those for you, okay? All right, so you can head out with your group, find a spot to go. One of your people, please, also one person in your group, please be the scribe, and you're going to put the answers to those questions. You're going to get 3 sheets of this paper, put 1 question on each Post-it, and then put your answers on those Post-its, and then we're going to bring them back and hang them up, and we're going to collect those, okay? A scribe. Grab your supplies and head out, and then come back. Ready, set, go.
Get out and stretch.
We should have sent you our schedule.
I was like, I don't know if he's what number. He's getting They're coming.
Which way do you want to go?
That way, right? I don't think there's anything that way. We'll just anchor back over here.
Oh, really? Oh, good. Thank you.
Try to go. We're all there.
Molly,
Yeah.
do you have the questions?
Oh, thank you. Yes. Okay. That is good. I'm glad you mentioned that. Yes. So I will have one of those. Yes. Also, if we could have a round of applause for Josh in the plaid. He is recording all of this. Woo-hoo. So, if you want to have a date with your significant other and would like to watch this video, it is going to be available to you free of charge. I know. Tim has already complained that the open bar wasn't available, so can put that on the evaluation. Yep, on that evaluation. So we have time for just a couple of comments, and so maybe if anybody wants to just share, we'll take 2 from maybe each question. What surprised you or struck you? Somebody want to say something about that? No right answer from what you said in your group.
Are you saying there's only wrong answers?
Oh, did I say there's no right answer? I will tell you if your answer is right or not. Go, Pauline.
We were surprised by the amount of funding it took to do one of those projects.
Surprised by the amount of funding.
Group 2, we were surprised how many things apparently are out there that we didn't even know about.
In terms of what?
Just different services,
Oh.
money sources.
Surprised by the number of services that are out there and connection that's happening with some people.
Yeah. No, the lack of, I mean, the amount of services that are out there and not always able to make those connections to the needs.
Okay.
Because not everybody knows
Yes.
they're there.
Services that are out there that people don't know about.
There we go.
Okay. All right. Looking at question number 2, which was something about, I can't remember.
Possible next steps.
Possible next steps. Thank you. What do we got? Buying lottery tickets, definitely. Voting that to housing. Yeah.
Miracles.
Miracles.
Talked about bringing the resources that we learned today back, and then thinking of different ideas. I know there was discussion about, yes, like the Rum River Coalition, we put together a fabulous booklet of resources, but then creating something that's more friendly to those that are going to be accessing it. So it's kind of like, your health card, right? Or a little brochure of being able to say, here's food, shelter, and then listing a couple there that may not be an extensive list, but then can connect you if they don't have the resources. So that was a big piece. And then we talked about, I know everybody that's here wondering if we can, with that email, that with all the information, also be able to share information about our agencies, because it has been eye-opening for me about I'm a very much a people person. I like meeting people in person and being able to have that relationship building. So
I can attest for that because you are so much nicer in person than I'm teasing.
I have to work on my poker face.
So I just want to say in the microphone what just said about taking resources that we heard about here back to our communities. And actually what you just said is something that Todd and Jody and I just talked about police officers and whoever having a small card that's QR code on it or whatever. So when you got your phone, that's all you're going to have, right? So it has to be mobile, okay? So that would be great. We're going to work on that. And one other piece that you had?
Everybody here today, if you would
stay connected.
Email chain, right? Just like all those little chain letters, but instead of letters and I love you, sharing resources about what you do in your
sharing information about our places.
Having contact information, because a lot of times I might know a manager, but then I don't know who oversees the programs, but I don't know who's going to be actually doing the intake. So when I want to connect someone directly,
then you know
then
who
I
that
know
is.
who.
Yeah. So more connections among our people. Natalie.
Similar to what you said, we said the building on connections, but really knowing about each other. Because sometimes, like, I know of, or we know of, but we don't really know about each other. And those of us who know about each other, having a better understanding, we're going to do better helping others.
Yeah.
Our group did mention more conversation like this. Continue, don't stop.
Yeah. So continued conversation like today. All right, looking at number 3, who's not in the room that should be? What other partners do we need to consider?
So one of the things I was thinking of, we talked about it somewhere along the way, so since about incarceration, well, we have a counselor, we call it program counselor, it's on the German County calls it a social worker, jail social worker, right? That person should probably be here because that's a person like for our design is set before someone leaves, if they've been with us for more than 30 days, we try to get them set up with whoever they need to, whether it's housing, whether it's just financial assistance, whether it's a medical assistance, whatever it is, but that person should be here as well, right? Working with Lakes and Pines or whatever, right? That's just a bridge so that when they walk out the door, we don't just kick them out the door and then say, yeah, well, we'll see you in a couple weeks. It's more of, hey, we're trying to help you, whether they take the help or not, that's a different story, but
at least there's something there.
But at least we're making an attempt to get somebody on the right track.
So bridging folks who've experienced incarceration with services available to get them started on the right foot.
All set up, we might get appointments all set up ahead of time or whatever else.
Good.
So those for lack, I think Sherburne County's jail social worker model, we call it program counselors, the same exact thing. Jails are just starting to do that, probably more and more.
Well, and I think just talking about that too, having social workers in squad cars now going out on calls, that's becoming increasingly more. Yep. Okay, yeah, that's right. Woo, there's one right there. Yay. So that's awesome.
You guys are on squad car, by the way.
Wow, you're amazing. So exactly.
Hey Molly, I think too we should keep pushing the schools to be involved with us.
Oh yeah.
Whether it's a building principal to a superintendent.
Good point.
Well, I have a listening device on you. Big ups to you. The school piece, and then the other thing, and we've had this a little bit at our previous meetings, is we should keep working on the transportation piece. Because we have turned into taxi cabs. And that's not what we're there for. I mean, I have transported to Maple Grove in squads at 2 in the morning, and I have one on it. Or St. Cloud. So those are things that we're at. We don't know what else to do because they're trying to get to a doctor's appointment. I'll be honest, I think there's been times where I think they purposely try to get themselves into trouble to get to jail.
That's no wow.
To get medical services or to get let's call it what it is. It's good food at jail. He says it's not. He's the one people in jail, but it really is good food.
And it's warm.
So I mean, those are transportation piece. I think we, at least in this area, it's not the best. So we need to keep working through that.
And you know, not to go down this path too much, we'll do it further, but that's this time of year is where people want to get arrested so that they have 2 lots and a cop.
Right.
That's our little saying in our world.
2 what?
2 lots. 2 lots.
2 hot
meals.
Wow. Okay.
I was gonna say city council members and Raj.
Yep.
And then I just thought of 2.
Raj.
So Raj is our hotel owner. It was like the bane of Todd's existence. But
Raj is a legend.
Molly, I am removing myself from the committee.
we will have him in some way.
It might be a fair trade.
Wow. Mic drop.
Yes, I want to file a complaint.
And then the emergency room doctors, I just thought.
Oh yeah, that's a good point. Medical. Yeah, really good point.
Who did you say before Raj?
I think we're missing.
City council.
Public health boards and public health nurses. What I mentioned in my group, I'm a county commissioner from Mille Lacs County. We don't have enough participation of citizens on our committees. The mental health board, the opioid board, the housing authority, they're all county employees that have things going away, but we need more input from citizens and we can't get it. Just like when we go out for requests for proposals, they don't get sent to the right place because it's only being sent to people on that board that know who they work with.
Okay. Hey, and thanks for both. What is your name again?
Dan Whitcomb.
Dan Whitcomb and Renee. Ran. So sorry. Both of these folks are commissioners, so we're grateful for both counties. Yay! And that's another piece, is just working with counties and cities. That's why the Rum River Coalition, 4 cities. I mean, we're just trying to make sure that we stay connected because all of us working together can ensure that we get something done, right? So it's not just one person, doing it here and there. And we shouldn't feel like, oh, Princeton got it or Malacca got it. It's like, no, just somebody get it so that we can start this.
I just want to mention your funding streams. There's a lot of money coming into the county on the opioid money,
cannabis money. So if you have homeless programs for youth that are affected by drugs, you can apply for those grants. There's no strings on them. There's not a lot of audit. Doesn't mean you'll get it, but there's a board that looks at that. If you're sitting on the board, you can advocate for yourself.
Yeah. I'm glad you said that too. The Minnesota Coalition for the Homeless is a great resource to look at too in terms of legislative updates. And when I asked the director, what we could be doing with advocacy, he said now that, the election's over and there's going to be new people in some seats, that really get to your representatives and share that we need to increase the budget for housing supports, or at least just say you support increased funding for housing supports, because they need to. One of the reasons there was so much funding, he said, is it 2 years ago now, I think, in that cycle, right? Because constituents came and talked to their people, and the legislators and the senators were much more versed on what was going on in their communities because of housing, because of them coming in. So our voices make a difference. People think, oh, nobody's gonna listen to me. No, they do. And so make sure that you get a letter off or give a phone call or whatever it is, because that really does make a difference. Mela.
I would say, just to add to that, having like a nonprofit or an organization that can help people with lived experience kind of get to those events at the Capitol, the Homeless Day on the Hill, the whatever, to get to your legislators and kind of teach you how to talk to them or to bring the issues to them or testify, whatever.
Yeah.
But then also to have it in a manner, like I said, I'm rural, so I don't go anywhere because I don't drive. So a bigger consideration, if you want someone to get down there and testify, or I chase senators down hallways and talk to them like I was here, But to compensate people for that and help them get there, not just go get there.
Help people with lived experience. I'm just saying this in the microphone so they can hear. Help people with lived experience get to the places where conversations are happening. Hang on once, Randy. Who's Tim? Tim.
Could we really quick just have everybody introduce themselves and where they're from? Sure. Because there's people, I don't know who they are, where they're from, but we may go, would that be our
That's who that is. Okay, hang on. I'm going to go with Randy here a second.
I just wanted to iterate, Lean, we have been raising funds to get people with lived experience to the Capitol. We get them transportation, hotel rooms. We do, on our website, there's things on how to talk to your legislators, and we've done it for the last 2 years, Day on the Hill, and also the last 2 MCH conferences in Duluth.
Oh, super.
So
Okay.
if you know anybody that's got extra money, send it to us. So
Tell them we won the lottery. So Lean has funds available to help to those places where those conversations are happening. Before we do introductions, this is Holly. I'm going to put you on the spot. She's with Crystal Cabinets. Let's hear it. Wow. So huge shout out. Yeah, did you want to share about the 50% off right now, or? Oh, perfect. Okay, let's do a quick. Alyssa, just
one more comment.
Yeah.
Like as next steps, also figure out how to tell the story to the broader community that might not, kind of building out that story from a lot of different angles.
Yeah.
That's really powerful.
Yeah, I'm glad you said that, because from this, what we're going to do is we're going to take all of these ideas, collate them, and then possibly put different buckets together of ways to kind of, if it's education, if it's funding, if it's infrastructure, whatever that might be. And then we'll put some people into those, or some leaders into those groups, and then give them to you to say which one of these do you think that you'd like to be part of, okay? That's kind of our next steps that we're looking at doing, okay? So I'm just gonna put the microphone over here. You guys can just pass the microphone. Just name and organization.
I'm Lori Irwin. I work at Sherburne County. I'm the Housing Resource Specialist.
I'm Marlena Josh. I'm a Central COC board member.
Randy Wickham, lived experience advocate through Lean, Central Minnesota Housing Partnership board member, and Central Minnesota Continuum of Care board member, and taxi driver.
Brandon Higgins. I'm with Unified Social Services. I'm the owner. I'm a housing provider here in the area, and then board member with Lakes and Pines.
Amanda Putnam, Unified Social Services Program Manager.
I am Charmaine Jones. I'm from Restoring Lives Community Church out of Zimmerman, Minnesota, Executive Assistant to Pastor Lorraine.
and she's my sister. That's why she said it. So pastor of Restoring Lives Community Church in Zimmerman.
Holly Martinson, Crystal Cabinets.
Jessica Unkelhauser, Lakes and Pines.
Dan Wickham, County Commissioner for Mille Lacs County.
Sam Piaski, Mille Lacs County Homelessness Prevention.
Derek Maygard, I supervise our HOPE team at Sherburne County Health and Human Services.
Tim Poland, I'm the Continuum of Care Coordinator for Central Minnesota, which is 13 counties in Central. We've met once.
Dennis Bishop, Head Elder at Faith Community Lutheran Church, Zimmerman.
Jake Gillard, pastor at Faith Community Lutheran in Zimmerman. I'm also an elected official just outside of the catchment area here in Springvale Township by Sandy County. I'm a supervisor.
I'm Jessica Nearing, the co-responder from Mille Lacs County Sheriff's Office, and this is my partner Rufus. He's a certified therapy dog that goes with me.
I'm Natalie Mathewson. I am the Community Development Supervisor with Central Minnesota Council on Aging. We're one of the 6 regional area agencies on aging in Minnesota. We cover 14 counties in the state. I serve the 5 eastern counties, and I live just outside of Mille Lacs County in Ogilvie, Minnesota, in Keniba County.
Hi again, everyone. Emily Carpenter. I'm with mHealth Fairview, Community Partnerships Manager. So one of the hospitals that I help to oversee the community engagement, community relations work for is our Northland Medical Center here in Princeton.
Hello, everyone again. Larry Hiscock, a Community Partnerships Manager with mHealth Fairview.
Heather Cleaver with Care Food Shelf in Elk River.
Cindy Lay, Executive Director at Open Doors for Youth in Elk River. And there's 2 people here that are both from Ogilvie. What are the chances? Wow. Right?
You are too? That's weird. No. Who else is?
Deanna Hamish, Executive Director, Central Minnesota Housing Partnership.
Rayanne Danielowski, Sherburne County Commissioner. And also I want to thank the Fairview for recognizing this as a extreme need. CentraCare Health has also recognized this, and there is another group that is working under their umbrella to work on solving these issues as well. So we should communicate with each other in that realm also.
Hi, I'm Julie Shane with, and I coordinate Age Friendly Princeton.
I'm Joelle Anderson Burr, Tri-County Action Program.
I'm Cindy Nauman with Freedom Center, and we have locations in Princeton, Onamia, and Malacca. We do substance use disorder services. We also do gambling treatment and anger management classes, as well as domestic violence classes for offenders. And then I'm also the co-owner of New Freedom, which is a men's treatment facility here on the north end of Princeton and has an outpatient in Aiken. Glad to be here.
I am Jessica Oval with Care Food Shelf in Elk River.
And I am Zach Carlton with the City of Elk River.
I'm Ashley Hall from Care Food Shelf in Elk River.
Teresa Kuba, and I work at Crystal Cabinets.
My name's Alyssa Wetzel-Moore. I'm Community Development Director with Minnesota Housing.
Hi, Jody Hirong-Dick, Planner with Sherburne County Health and Human Services.
So I'm Bradley Hunt, captain for the Mille Lacs County Sheriff's Office. I served both captain for the jail for about 7 years, and now I'm on the roadside. So.
I thought you were going to say you're somebody else. No. No. Wow. Todd Frederick, Chief at Princeton Police Department.
Pauline Ewert with New Life Church.
Josh Hammer, Crystal Cabinets Marking Team.
So we also will be sending out some kind of evaluation. So we ask for your input on that so that the next meeting we know some of the things maybe you want to discuss more, get into more, and other people that we think we should have here. So any other things we need to mention for anybody? All right, hey, sorry we're a little bit over. Thank you so much for sticking with us, and have a good rest of your week. All right. Yeah.